right, so today we're going to be talking about something that affects a whole lot of people, right? We're talking about step-by-step guide to managing knee osteoarthritis and living a pain-free life. All right. The reason why we are doing that is because we're having much more complaints about people that are coming down with this kind of condition. So let me just bring in my guest right away to the microphone. Mr. Chukwuemeka Amobi is a licensed physiotherapist with our Jolad Hospital. Mr. Amobi, it's nice having you in the studios. Good morning.
Good morning. Thank you for having me.
And how are you doing?
I'm great. I'm excited to discuss this very important topic, and I'm hoping that we can do justice to it.
All right, we'll definitely do justice to it. So for those who might not know really, because a lot of times when people want to dance, when they want to walk, when they even want to play comfortably, sometimes they have some kind of discomfort with their knees. So what is knee osteoarthritis? Talk to me.
Okay, so generally you have complaints of knee pain. We see these complaints almost every day in the clinic, and most times people associate it with aging. But what they don't know is that they're dealing with knee osteoarthritis most times.
So it's not an aging kind of problem.
Aging is a factor, but it's not the only factor.
Okay.
So basically with knee osteoarthritis, what is going on is breakdown of cartilage in the knee joint. So when we speak of cartilage, just think of a protective covering that covers the knee surfaces. So what happens is it thins out, the joint spaces close up, and then it leads to wear and tearing, pain, discomfort, and general reduction in flexibility at that knee joint.
Okay.
And it's a condition that is very common.
Okay.
And if it is not handled in time, it can lead to a total damage of the joints. But the good news is early intervention can ensure that you get back to full functionality and you're pain-free. All
right, so we'll talk about that good news even as the program moves on. But so for clear understanding now, osteoarthritis is a condition that affects which part of the body?
So osteoarthritis affects the bones generally.
Okay.
So
not just the knees alone.
No, not just the knees. So
it could be any part of the body.
Ankles, shoulders, generally any joints in the body. But we're talking particularly about the one that affects the knee joint. Yeah.
So you said it's a common kind of condition, right?
Yeah.
So put it in perspective. So if we're 10 in this room, how many of us will come down with osteoarthritis?
So at least 1 in 10 people usually have deal with osteoarthritis. So statistics from 2021 says that there are about 374 million cases of knee osteoarthritis then. And then about 30 million people, newly diagnosed cases, were discovered in 2021.
Wow, 30 million.
Yeah,
that's a huge figure.
It is a huge figure.
Now, that's a global figure, right?
That's a global figure.
Let's bring it down to Nigeria. So here in Nigeria, what does it look like?
Here in Nigeria, we don't have that much statistics to go by.
Okay.
But what we know is that it affects people usually from age 45 towards the old age. So women are more affected.
I was just about to ask that. So which of the genders?
60% more women. Well, 60% of these people are women.
All right.
And that's because of some factors. So for example, the differences in the anatomical structure of the knee between men and women. So generally women have wider hips than the knees. So there's a malalignment between the joint structure, and then there's there are uneven distribution of stresses at the knee joint for women. You also have hormonal imbalance issues
as well.
So estrogen, the female hormone, is known to support cartilage. Now there's a decline in estrogen levels after menopause.
That's very true. All right. So I know that there's a whole lot of conditions, and I would still touch more on the causes and all of that. But how does it affect daily life, Mr. Amobi?
So you have people complaining that they can't function as much as they would want to. So you have situations where they wake up in the morning, they are not as swift as they would want to be. There's stiffness at the knee, especially in the elderly. You get complaints of them saying they can't carry out their exercises they would want to, because of pain. They can't play with their grandchildren as they would want to, because of pain. So it even affects their mental health, because they are dependent, and then it's a frustrating condition for some people,
right?
But as we said,
there's a way out, right?
There's a way
good
out.
news. We'll talk about that good news as well. So, but Amobi, what are the common symptoms for osteoarthritis?
Okay, so you hear patients complain of persistent knee pain, especially with increased activity or after sitting for a long time. That pain comes and is persistent. If that happens, you should think knee osteoarthritis. Another one is stiffness, especially in the morning. So you hear your patient tell you that they wake up in the morning and it takes about 4 to 5 minutes for them to be able to move as swiftly as they want to move normally. So when a patient complains of that, or if you're experiencing that, you should think knee osteoarthritis.
Okay.
Another symptom is swelling.
Swelling of the knees?
Yes, swelling of the knees, inflammation, feeling of warmth around that knee joint. Another symptom could be hearing cracking sounds or grinding sounds when the patient is walking. And then a general difficulty in bending and straightening the knee, difficulty with climbing stairs, and in general reduced flexibility at the knee joints. So these are some of the common symptoms of knee osteoarthritis.
Okay, so I was just having a conversation with my colleagues earlier on, and one of them did say when he's climbing the staircase, he usually experiences this kind of discomfort, so to say.
So you need to visit us.
Okay, which is true. So, but what causes this?
It's the general inflammation at the knee joint. Remember, we said it's a condition that comes with aging. So there's wear and tear, at the knee joint region, and that would lead to a reduction in joint spaces, and then there's a reduction in flexibility.
So any age from 45, right? You're likely going to be.
So it can affect even young people, but mostly people in middle ages and the elderly are mostly affected.
Okay, but that's just one of the risk factors, right?
So another one is if the person has had prior injuries to the knee from sporting activities, or maybe from trauma from an accident and all of that, that will predispose them to experiencing knee osteoarthritis at later stages in life. Another risk factor.
No, before you go to another risk factor, so are you saying that most of our footballers are likely going to come down with this?
So a lot of sports people are dealing with one form of or one level of knee osteoarthritis or the other. However, most of them have strong thigh muscles. We'll get to that.
Okay.
So that sort of takes off pressure off
from it.
Yeah.
Okay. So you're about talking about another risk factor?
Yes. So excessive weight. So when there's excessive weight and then in obese patients, there's increased pressure on that knee joint. There's an uneven distribution of stresses and weight at the knee joint, so that will predispose such individuals to knee osteoarthritis. Also, jobs and sports that involve repetitive movements. So any job that involves heavy lifting, squatting, and it's also involving the knee and the ankle joint, that will predispose them to knee osteoarthritis. Another one is genetics. Yeah, so you have some families where,
so it could be inherited.
Well, not necessarily, but you have some families where you have people who had maybe their father or their mom or their aunties had knee osteoarthritis, so it sort of increases your risk and predisposes that individual to knee osteoarthritis. Also, excessive alcohol intake. Yeah,
alcohol again.
Excessive alcohol intake is known to increase the risk of knee osteoarthritis and progress the condition. So
this alcohol self, you're everywhere. What should we do to you now? All right, so excessive alcohol intake could also lead to osteoarthritis.
Yeah, increase the risk of knee osteoarthritis. So these are some of the basic risk factors.
Okay, a lot of times we mention arthritis. Is it the same condition with osteoarthritis, or this is just a variation?
So there are different kinds of arthritis, So there's rheumatoid arthritis, which is systemic. What we're talking about is osteoarthritis, which affects the bones.
Okay.
There's also gout, so that
another
deals
one.
Deals with the buildup of uric acid.
All right. I'm tempted to call you doctor, really. So, Dr. Amobi, how is osteoarthritis diagnosed? Okay,
so there are a series of tests. Let me talk about my own forte. So generally with physiotherapy, we carry out a full assessment. So basically, you want to find out the patient's history. When the patient comes in and is complaining of pain, because that's the major complaints they come in with. So you want to know the onset of the pain. What are the aggravating factors? What are the factors that help relieve the pain? You want to also find out if they've had past injuries at the knee joint before. That's the first thing you want to find out with your patient. You also want to observe them in standing, walking, climbing, change of position from sitting to standing, to see if there's any muscle weakness going on, if there's any pain. You would actually see the patient probably flinch or show signs of pain. You're also checking for abnormal gait patterns. So because there's pain, you would realize that some of these patients walking with a limp. Even though they try to hide it, but to the trained eye, you will see that there's a limp. So you do that observation. There's also something that we do called palpation. So you're touching the knee to feel for painful areas.
All right.
You're touching to feel for warmth.
Okay.
That's a sign of inflammation. So you want to know if that is also present. You're also checking the muscles around the thigh region for weakness, for muscle tightness. If there's any muscle shrinking, you want to know that. If there's any loss of sensation at that region, so you check that. You also check for balance and coordination. So one complaint that patients would tell you is that they feel unstable on the knee, especially when they are navigating stairs, climbing upstairs, or navigating areas with uneven surfaces.
All right.
They feel that the knee will give way.
Wow.
So you want to check for that balance and coordination aspect. And then there are also some specialized tests that you carry out to ascertain the integrity of the ligaments at the knee.
All right. We'll get to much more of some of these tests as well. But Mr. Amobi, is it curable if I have a recurring pain in my knees?
Oh, yeah. So what we're saying is that pain can be mitigated, can be brought down to a zero. The stiffness can be dealt with such that you regain your flexibility and you get back to your full active life.
It's possible.
It is possible, especially if we catch it
early.
Yeah.
Okay. So if I've been having this pain for, let's say, 3-4 years, is it still redeemable?
Well, to an extent.
It can.
To an extent, because from 3 months, we say that it has now become a chronic condition.
Right.
Yeah, so we might not fully cure, but what we're saying is that we will return you to a comfortable level where you can function at optimum levels and go about your daily lives without
any
discomfort.
Stress. Yes. All right, then Lagos Traffic Radio 96.1 FM. We're having a step to, or a step-by-step guide towards managing knee osteoarthritis, and Mr. Chukwuemeka Amobi, who's a licensed physiotherapist, is our guest on the program this morning. Quickly, a flash update coming in from the control room. Breakdown of a 40-foot container loaded truck having mechanical fault. This is at Independence Tunnel inwards Idiroko. It's causing some traffic, and backlog right now is by the edge of the bridge. A tow van already contacted, but traffic managers on ground trying to ensure that you can still have it pretty good. Those of you making the journey towards the island, beyond that point, heading towards Safari is also looking good. Funshaw Williams Avenue, not bad at all. Eco Bridge is very, very good as we speak as well, and all that corridor is good. All right, then. So earlier on, we had an incident. Okay, this is by Alausa, but of course that has been taken off. No major worries there. The Third Milan Bridge is a very, very smooth ride. The entire stretch of the bridge looking good. Those of you coming in from Anthony, linking up with Bagada to connect Yanowuru and the Third Milan Bridge, also looking good as well. But Lagos Abeokuta Expressway, you have it good from the Jopomu end, linking up with Cement. Approaching Ilezik, you might have it slow due to the fact that it's a merging point. From Ilezik, linking up with Keja Long down to National, slow and steady is the name of the game. So if you want to join the conversation as well, you can feel free to connect with us this morning. Yes, we're talking knee pain, right? Or perhaps knee osteoarthritis. That's the name, perhaps the technical name. But if you're having this recurring pain in your knees, Dr. Amobi, or rather Mr. Amobi, is letting us know this morning that there's a whole way that you can deal with it. Okay, so feel free to connect with us, and that's on 091-5387-7127. Okay, that's 091-5387-7127, or perhaps you can also connect with us 080-99-120-777. All right, that's those are the numbers that you can use to connect with us this morning. This one says, good morning, Victor. I've been feeling stiffness in my knees. I have a call. Okay, let's see if I can pick that one as well. Hello there. Hello.
Yeah, hello.
Yeah, good morning.
Yeah, good morning.
All right, what's your name?
Lagos Traffic Radio.
Yes, Lagos Traffic Radio. Hello. Okay, so if you want to connect with us, please, the moment you get through to the studios, please endeavor to turn down the volume of your radio so that we can have a good conversation. This one says, good morning, Victor. I have been feeling stiffness in my knees every morning. Could this be early osteoarthritis signs? Sheyi is sending that one in. All right, Mr. Mobi, he says every morning?
Yeah, so again, it depends on how long he's been feeling it for. So what we say generally is if he's been feeling it between 3 to 6 weeks, it's a bit more acute. If it's he has been feeling it for more than 3 months, we would say that it's chronic. Okay. If early morning stiffness is a sign, so he might want to check that out with a licensed physio, or come to the hospital and see a doctor. All right. And you'll be referred. Yeah.
Okay, then 091-5387-7127. Another message here says, good morning, Victor. Happy new month. Please ask the guest what exactly causes the cartilage in the knees to wear out. Is it from overuse or aging? Thanks, Kolakbo from Oshodi. So which of the two, Mr. Amobi?
So, yeah, it's a combination of factors. It could be from aging, So think of it as if you buy a new car today, 7 years from now, it's not as new as when you bought it. So that's where the aging factor comes in. It could also, remember we spoke about repetitive stresses. So he's also right to talk about overuse. So if he has been engaging in activities that involve continuous use and pressure on that knee joint.
I hope you're not referring to those that walk a lot. For those that trek a lot, I hope that will not be part of a factor.
Well, not necessarily. It depends on what shoes you are wearing, where you are walking, if the surfaces are smooth, and then the person's general well-being,
All right. Okay, another one here says, Victor and Doctor, usually He said, Victor, doctors usually say walking is good, but I started having knee pains and signs of osteoarthritis when I started walking. So why is that? Okay, why is that so? Nuruddin is sending this one in. Nuruddin, thank you so much. So could you say that?
So walking is good, generally as a form of exercise, especially brisk walking.
Let me take this call first of all. Just 1 second. Hello there. Good morning.
Hello?
Yeah, good morning.
Yeah, good morning. My name is Alex. I'm calling from Kurudu.
Okay, Alex, how are you doing?
I'm doing fine. Doctor, please, my own knee has been disturbing me since last year. I've actually taken a lot of drugs, but it will be like if someone is having a headache, it will constantly be
it's aching you
so much. So much. Even though if I'm sleeping, it also hits me. Sometimes I sit down 5 minutes or 15 minutes. If I stand up and want to walk, it will hold me not to even walk properly. So after some time, it will now allow me to also walk. But the thing is aching. I've taken so much of drug, but still the pain is still there. It's not really paining me, just that let me talk in Yoruba. Continuously come that's the way it is.
Okay. So which of your knees? Is this your left or the right?
The left one that I'm not even using to drive. I'm using the right one to drive. But the left one that I'm not even using, it was the one that actually aching me. So even though he has disallowed me not to go and play ball again. Okay. Every Sunday I play ball, but now I can't play ball anymore because of the leg.
All right then. Just listen on your radio. Thank you so much, Alex from Ikorodu. All right, Mr. Bobby.
Yeah. He says since last year his knee has been hurting. He's taking a lot of medication. So medication is also good, but what medication is really doing is masking the pain, and it gives you some relief. Now, with these symptoms he's talking about, the constant pull and all of that, it shows that there's some muscle tightness going on. There's some joint discomforts going on. So he needs to see a physio to do a proper assessment of the structures now.
Okay.
He needs to see an orthopedic consultant, and then a physio for us to carry out a proper assessment of the structures, the ligaments, the bones itself, and the muscles surrounding.
Is there a remedy for him?
Oh yes, there is. I mean, we even like working with people like this because he has a goal. He wants to get back to playing football. Right.
He's been doing that every Sunday, he says, but now he can't do that anymore.
So you find that such patients are even motivated to go through your treatment because they want to get back to what it is. So there's a remedy for him.
Let me bring this to your attention, Mr. Amobi. We've seen that women, as they age, the knee becomes a major problem. Like you said earlier on, those with hips, right? Massive hips and all of that. Yeah. The knee becomes a problem. Yeah. Is there a remedy for them? Those that are in their 50s, 60s, 70s?
Definitely. Definitely. So like we said, because of the difference in the anatomical structure between women and men, women are more predisposed to that because of hormonal imbalances also. Statistically, I hope I'm not thrown under the bus for this, but statistically, women are known to be more obese than men.
Okay.
So these are some of the reasons.
Or anatomically.
Well, but that's what statistics is.
Right.
Each patient is different. And sometimes the approach to treating women in that age bracket and with such conditions is a bit different.
Let's quickly talk about Arjolad and what you guys are bringing to the table. What do you guys do with treating or managing osteoarthritis?
Okay, so we have in-house experts, orthopedic consultants and doctors, that would run a proper diagnosis, if you come in with these symptoms, and then you're sent for radiological investigation, because it's important that we see what's going on with the knees. So an x-ray or an MRI or a CT scan, all that is in-house. It can be done within the hospital.
So if they come to Arjolad, all this can be properly managed.
All right.
There's a message here. It says, are there any home remedies that genuinely work for managing knee pains?
Okay, so there are a couple of things that you can do. First off, what you want to do is with the pain, you can use either heat or ice. So so generally with
like the ice blocks.
Yeah, so crushed ice, wrapped in a wet towel. You don't want to place that. You don't want to place the ice directly on your skin, so it's always advisable to wrap in a wet towel. Now that would help deal with the inflammation and the swelling.
Okay.
After a while, what patients are now dealing with is not the swelling, it's stiffness at the knee joint. So what you want to use in that instance is heat. So just remember, ice for swelling and heat for stiffness.
All right. A message here says, Happy New Month. Please, sir, I sometimes hear grinding sounds in my knees. Is that normal? And is it possible for one knee to be worse than the other? Thanks. Rosaline is sending this one in from Ikpaja. All right, Rosaline, thank you so much. Is that possible?
Yes, so hearing grinding sounds is not normal. There's obviously something going on with the knee, and there's obviously some muscle tightness. And it is very possible for one knee to be worse than the other. It just depends on how she walks. I spoke briefly about gait patterns. So it's possible that she's bearing more weight on one knee, and that's just her natural walking pattern.
We have to go, Doctor, because of time constraints. So for those who would like to really connect and perhaps come to our Jolad to have the best of treatment, you're saying all of this is well manageable and curable, so to say? Well
manageable. So you see the doctors, you run your radiological tests, and then we have in-house physiotherapists that walk you through detailed treatment programs because each patient is different, so all of that is well managed in our Jolad, so you can come through and we'll take care of you.
All right, then we'll leave it at that for now. It's nice having you in the building. Thank you so much for being here.
Thank you for having me.
And I hope listeners out there, you must have learned one or two things. If you're having recurring knee pains, well, Mr. Amobi has just given us the guide on how you can really manage it. But the best of, or perhaps the best thing to do, is to see the experts like him. He's a physiotherapist of several years standing, and he's one of the very rich crew from Arjolad, just working there and able to let you in on how you can manage all of that. Let me see. They've got one or two numbers here. You can always send a mail to them, www.arjolad.com. That's on the website, or you can send a mail to wecare@arjolad.com, or you can call 07000 756523. That's 07000 756523. A brief break. When we return, we'll still be talking about support systems for the vulnerable. Now that we are on holiday, or perhaps the holiday season, there's a whole lot that youths can tap into, and each Tolerant will be taking us through that.
Point to point on the road, rails, and waterways. We bring you up to speed with the latest traffic news, views, and comments from transportation experts.